Hello, my name's Brandon, and this is my audience. Yeah, look at the camera.
No, it's okay.
Tonight I will be talking to you about medical marijuana and the expanding social reality. According to the Marijuana Policy Project, since 1996, 16 states and the District of Columbia have enacted laws that effectively allow patients to use and access medical marijuana despite federal law. To be effective, a state law must remove criminal penalties for patients who use and possess medical marijuana with their doctor's approval or certification. Effective laws must allow patients to grow their own marijuana and/or allow a provider to do so for the patient. This speech will consist of the medical benefits of marijuana, the medical history of marijuana, and also like my own opinion of medical marijuana use. The first thing that I will be talking to you about are the medical benefits, the medical benefits of medical marijuana. And there's a study showing that medical marijuana can help cure 200 different ailments. Some of them including nausea. It actually helps slow down the spreading of cancer by there's a chemical in cannabis called CBD or cannabidiol, which actually slows down the spreading of the cancer virus in most cancers like breast cancer, brain cancer, lung cancer. Those can all hopefully be prevented with cannabis. Other treatments are glaucoma, pain, migraines. It slows tumor growth. It relieves symptoms of chronic disease, prevents Alzheimer's, prevents seizures, helps people with ADHD, and may treat multiple sclerosis. Helps relieve PMS, and it could also help calm people with Tourette's or OCD. What I just talked to you about was the medical benefits of marijuana, and now I'm going to go into the medical history of it. Marijuana was actually originated in Central Asia, mainly in India, where they used it to make fibers and clothes since 4000 BC. In 1000 BC, India used cannabis for ailments such as mental illnesses, pain, skin ailments, diarrhea, and also depression. Chinese used the seed of the cannabis for rheumatic pain, intestinal constipation disorders, and the female reproductive system, malaria, and other diseases. The Atharvaveda, which is a collection of sacred texts from unknown authors, mentions cannabis as one of the 5 sacred plants, referring it to as a source of happiness, donator of joy, and bringer of freedom. Hence, cannabis use became part of the numerous religious rituals in the region. For most American history, growing and using marijuana was legal under both federal laws and the laws of the individual states. By the 1940s, marijuana's therapeutic potential began to be recognized by some U.S. physicians. From 1850 to 1941, cannabis was included in the United States pharmacopoeia as a recognized medicinal. By the end of 1936, however, all 48 states had enacted laws to regulate marijuana. Its decline in medicine Its decline in medicine has hastened by the development of aspirin, morphine, and then other opium-derived drugs, all of which help to replace marijuana in the treatment of pain and other medical conditions in Western medicine. The concept of deadening pain by artificial means is very ancient. Herodotus, Pliny, and Dioscorides mentioned drugs that were employed for the purpose. Mandragora was used by Italian physicians. The Scyths of olden time inhaled the vapor of hemp to produce intoxication, and we have read of a Chinese physician who anesthetized who used it as an anesthetic for his patients with the preparation of cannabis in order to obviate the pains of surgical operations. Cannabis indica became available in American pharmacies in the 1850s following its introduction to Western medicine by William O'Shaughnessy in 1839. In its original pharmaceutical usage, it was regularly consumed orally and not smoked. The first popular American account of cannabis intoxication was published in 1854 by Bayard Taylor, writer, world traveler, and diplomat. What I just talked to you was about the medical history of cannabis, and now I will go into my opinions on medical cannabis and just the usage of cannabis. And me personally, I believe that it does help. It does help from personal experience. Yeah, there's a lot of studies that prove that cannabis actually helps your body, like with the cancer. There's the glaucoma. It says that it helps with anxiety and depression. I wouldn't know about that, but I believe it. I believe doctors. Now let's take a brief look over everything. First, I talked to you about the medical benefits of medical marijuana. Secondly, I talked about the medical history of marijuana, and lastly, about my opinion on medical marijuana. In conclusion, I encourage all of you to figure out your own understandings about medical marijuana and find out where you stand on this topic. Are there any questions? Okay, thank you.